In our series on dysphagia, we're going to talk about a number of the causes in our future videos. Today we're going to start with achalasia. Achalasia is a very rare cause of dysphagia, but it's an important one to know about. It generally refers to difficulty in swallowing in patients due to incomplete or absent relaxation of the lower esophageal sphincter. So patients will complain of a number of symptoms. Not only will they complain of difficulty swallowing both liquids and solids, they'll complain of belching and sometimes regurgitating undigested food. They also may complain of chest pain from time to time as well, and again this relates to the fact that the lower esophageal sphincter doesn't relax completely or even partially. The reason achalasia occurs is sometimes unknown, so the causes may include idiopathic causes, but also it's related to malignancy, it's related to infections such as Chagas disease by trypanosomes, and also can be related to invasive disorders such as sarcoidosis and amyloidosis. What you see in terms of the pathology of the disease is you see a loss of inhibitory neurons at the lower end myenteric plexus of the esophagus. And it's the loss of these inhibitory neurons that prevents the actual lower esophageal sphincter from ultimately relaxing. That's pretty much in terms of the background and the pathophysiology of achalasia. Let's move on to diagnosis and how you treat someone who suffers from this disorder. Investigating a patient with achalasia really relies on three simple tests. The first is a barium swallow, and what that will show is tapering of the lower esophagus into a very narrow part, and it's often classically described as a bird's beak appearance on barium. In terms of other investigations that will be required to make the diagnosis, ultimately the best investigation you can perform to confirm the diagnosis conclusively is doing manometry, so measuring the actual relaxation pressures of the lower esophageal sphincter and the lower esophagus itself. What manometry will show you is that there's incomplete relaxation or absent relaxation of that lower esophageal sphincter, and it may also show absent peristalsis of the lower esophagus as well.